Good afternoon, ladies and gentlemen. Good to see you this afternoon. Our Burke County Board of Commissioners meeting for the Board of Health will be called to order for Monday, July 27th, 2026. I'll ask you as you come today, be sure the red light comes on at the podium as you're speaking so that we can get good recording. Remind you to silence all your mobile devices. And Madam Clerk, all commissioners are present with the exception of Mr. Vice Chair Smith, who is still on some medical recovery. All right, this time I'll ask Commissioner Barry to lead our invocation.
Privilege of serving the people of Burke County. We acknowledge that every good gift comes from you and that true wisdom begins with the fear of the Lord. We ask that you grant this board wisdom, discernment, and integrity as we consider matters that affect the health and well-being of our citizens. Help us to make our decisions based not on politics or personal preference, but on truth, compassion, sound judgment, and genuine desire to serve others. Give us hearts that value every human life because each person is created in your image. Bless the doctors, nurses, first responders, public health workers, emergency personnel, and all who care for those who are sick or vulnerable. Strengthen them for the work you have called them to do. We also pray for the families of Burke County. Bring healing where there's illness, comfort where there's grief, hope where there's discouragement, and peace where there's fear. Guide our community to seek not only physical health, but also the spiritual healing that is found through Jesus. May everything done in this meeting be honorable in your sight and for the good of the people that we have been entrusted to serve. We ask these things in the powerful and holy name of our Lord and Savior, Jesus Christ. Amen.
Amen. Thank you, Mr. Barry. Let's join together the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Gentlemen, you've had the agenda for our meeting for a few days. I'll entertain a motion to approve the agenda as presented.
Mr. Chairman, I'll make a motion to approve the agenda as presented.
Thank you, Mr. Stroud. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. We have no minutes of previous meetings to approve. That'll bring us to item 6, presentations. This will be presented by our Health Department, required annual training for Board of Health members. And this will be presented by Ann Absher, UNC Gillings School of Global Public Health. And we'll ask Miss Ashley Garrett to make some introduction, perhaps.
Perhaps. So one theme that Mr. Epley and I have really talked about over the last couple of months is flexibility. So today's another day where we are going to be flexible, and I will be presenting this training to you as unprepared, but as great as I'm going to do it. So please bear with me as we work our way through this training. I hope not to take too terribly long, so maybe we can get through this a little bit quicker.
All right, very good. Well, I've been on a mission trip for a week, and we were told right off the bat we needed to be fluid and pivotal.
That is correct.
And that turned out to be quite true. And so you're right with it. So
yep.
Hang in there.
So the reason we're here is because annually we are required as the Board of Health and Public Health to do this training so that as new board members come on, we all have the same training. So this is roles and responsibilities of North Carolina local public health governing boards. So this is required in general statutes, and within the general statutes, you'll be able to find where the County Board of Health requirements lie and their terms and appointments. So the learning objectives that were structured for this is to identify the role of Board of Health and what they play in carrying out public health core functions and essential services. It's to discuss the legal responsibilities and authorities of local public health in North Carolina, to describe public health governing structures in North Carolina, and to describe the guidelines and expectations for being an effective board member. So on the agenda for this training is public health milestones, current challenges, and the core functions of public health, legal responsibilities and authority, and then public health governing structures, board member roles, and the effective governance. So local boards of health can be run through a county or a district. So if counties would like to merge with their other counterparts, they can create a district board of health and board of public health. You can have a consolidated human service board, you can have a public health authority board, and you can have a board of county commissioners, which is what we fall under. So public health milestones, current challenges, and core functions. So the core function of public health is to prevent infectious diseases. So as you know, communicable disease is a program that we house in Burke County and within the Department of Public Health. It is meant to mitigate communicable diseases throughout Burke County. Now, this is a core function that we have. It's mandated by general statutes that we maintain that program. We help promote clean water and air and food through our environmental health services, which is also a core function of public health and required by general statutes. We work to prevent injuries, promote and encourage healthy behaviors, respond to emergency disasters, and ensure the quality and accessibility of health services within Burke County. So sometimes we're not tasked with doing the job, but finding out where the gaps are and who can fill those. Oh, I just ran through those. I'm so sorry. So what is public health? Public health is organized community efforts aimed at the prevention of disease and the promotion of health. It links many disciplines and rests upon the scientific core of epidemiology. So for example, car seats. We've had car seats for a long time. That's an effect of public health law. We have lots of new harm reduction services that are coming out, and that is to reduce harm for the health of the community. So that lies within the public health space, and this is the things that we work on at the local, state, and federal level. So what is public health? Prevention of disease. Addressing the risk factors for disease or injury. So encouraging sunscreen use and protective clothing to prevent UV radiation exposure. Promoting health, enabling people to increase control over and to improve their health. So that's where our health education department comes in, advocating for healthier neighborhoods, sidewalks, playgrounds, promoting health throughout the community. Our greatest achievements, vaccinations. So we do a lot within this space, especially at the federal and state level, but also locally, we're allowed to enforce and encourage different vaccine laws as it aligns with the commissioner's priorities and the health of the community. We prevent infection. We help promote safe work places, motor safety like the seat belts. For example, next week we'll be looking at mortality rates in Burke County, so our vital statistics. Hopefully you guys will be able to attend that meeting. It will be a presentation from the North Carolina School of Science and Math students, where they've taken our vital records and are going to show the analysis of that data and see what the trends are for Burke County over the last 5 years. We promote safe and healthy foods. Sometimes we promote fluoridation in drinking water. We promote healthier mothers and babies. We recognize tobacco as a health hazard. And we promote family planning for, again, healthy pregnancies. We've also done some work in the cancer prevention space, such as tanning requirements and the laws and how much tanning bed you can use, childhood lead poisoning, and public health preparedness and response. Public health's main goal is to prevent disease and to promote the health. Great public health achievements include mass vaccination, healthier mothers and babies, and our motor vehicle safety. Continued improvement in areas throughout the beginning of the 21st century, and they're still continuing. And we still have major challenges as, you know, health continues to evolve, new diseases emerge, and diversity in how we promote our own health continues to happen. Big picture of public health. How does the work of a governing board with oversight over us fit into the bigger picture? So in 1988, this was the first report that came out about what the future of public health is. This is what really was the catalyst for public health across the states. This was a recommended read within the health sector, and it created new governmental functions at the federal, state, and local levels. It reestablished boards of health or public health councils to assess public health needs, develop public health policy, and ensure that public health services are available. So this was really the formal structure that began public health, especially at the state and local level. Board of Health members serve as advocates for our health, so advocates for Burke County Public Health, brokers between policymakers and the provision of public health services. What we're also required to do is a community health assessment, which we presented to you guys at your May, I believe, or March or May, I believe, one of your commissioner meetings. Was it what? May meeting. This was recently done, and we have a new set of priorities that came from our community. We survey the community for several months. They pull together their top priorities, and then we take the community again to identify their top 5 and 3 of the 5 that they would like to focus on. And so we do have that in your packet so that you can review that as you're starting to think about the health of Burke County and what you would like to prioritize. We do go on a certain cycle, it's 3 years. And then on top of doing that annual or that community assessment, we also have to provide a community health improvement plan, which is a plan built with the community again on what interventions we want to put in place that meet those community health priorities that were picked out. So assessment makes it possible to understand the main health concerns in the community, factors that influence the health of Burke County, assets and resources in the community, and where to intervene to create the positive change. So this is a really good tool for us to use so that we understand the health of the community from the community lens, not just based on data. So boards and policy making. So you guys will we will make operations and management policies on behalf of the LHD. Then the policy is limited by state laws and county ordinances. Give advice and help health directors make decisions. So you don't need to be into the daily operations of Burke County Public Health, but we want you involved in the priorities that we have. We want to make sure we're in good communication with you. We want to know what you guys put as a priority. We want to align with what the commissioners have in mind and the Board of Health has in mind. So tips for developing effective policies. They need to be written clearly and explicitly, free of jargon, current, and include the date and renewal and available to everyone, which we have PolicyStat, which is our software. I know Morgan has access and Mr. Britton has access, and that is where if you wanted to look into our policies, you're more than welcome to. Otherwise, if you have questions, I'm happy to sit down and review any policies with you as well. So assurance of the Board of Health. The Board of Health assures public health services are provided, even services provided by other organizations, which is what I was saying. Sometimes we don't have to do the work, but we need to find the gaps and assure that people are able to fill those gaps within the system that we have in Burke County. We need to assure public health policies and programs are in place and working. So are they optimal? Are they doing what they're set out to be? Are they efficient? Work with the health director to anticipate trends likely to affect the department or the community. So emerging diseases, financial challenges, worrisome concerns that you guys might be seeing. Assure the public health agencies have the resources and infrastructures to provide those services. So in summary, 3 core functions of public health is assessment, policy, and development and assurance. We have 10 essential services within those core functions, which really goes into the weeds. And these services represent crucial aspects of your board's activities and responsibilities. And please, during this, if you do have any questions, I'm happy to take them. Or if you want to wait till the end, we can do that as well. So here are the legal responsibilities and authorities. So the legal authority of public health, this law declares that the mission of public health system is to promote and contribute to the highest level of health possible for the people of North Carolina, and it requires each local health department to ensure that the 10 essential public health services are available and accessible. This general statute requires each county to provide public health services by operating a county health department or consolidated human service agency, or by participating in a multi-county district health department. Alternatively, a county may form a single or multi-county public health authority. And within this general statute or set of general statutes, all types of local health departments are governed by local boards of health, which serve as the policy-making, rule-making, and adjudicatory body for the department. In some counties, the Board of County Commissioners serves as the Board of Health. And finally, each local health department must have a local health director who has education and experience in medicine, public health, or public administration related to healthcare, and who exercises legal powers and duties set out in multiple state statutes and rules. So here are the sources for public health law in North Carolina, which I'm sure you guys are very aware of. So you guys are a governing board. You will oversee and help give direction within the health department, which will be executed through the health director, which then I come back to you and talk again, and we create this community or this cyclic role of communication between us so that you guys are aware, you know what's going on, I communicate it back to you, you give advice, we keep this continuity of communication moving forward. Local health departments vary in size, location, and structure. So this is sources of authority governing local health departments. Looks like this slide's trying to explain the essential services, which is in general statutes, our mandated services, our accreditation rules, and our public health powers, duties, and programmatic requirements. All throughout general statutes, 140A is where you'll find a lot of our public health rules and regulations.
Yeah.
Yes.
Quick question. The difference between essential services and mandated services, that's something we deal with a lot. Can you expand on that just a
Yeah.
little bit?
Mandated services are what are in general statutes, is the bare minimum that we have to have per general statutes. Essential services are, for lack of better words, best practice. That is going to give you a healthier community. It's going to give you a more robust health outcomes. That is what's not mandated, but is essential for a healthy community.
What is our mandated? Do we have 12 mandates?
What we have to have, there's also 2 different ways of mandating. So there is what the county has to have, what we have to have as a local health department. And then there are things that we have to assure exist in Burke County. Doesn't mean that we have to do it, but we have to assure that child health exists in Burke County, which means we have to have pediatricians. We have to assure that we have maternity care. We have to assure that we have women, infant, and children's. We have to have, through the health department, through the county, environmental health, communicable disease, and then the health director, and I believe 1 or 2 other actual FTEs. So that is where it really starts to get, the state does not want to over regulate and tell us what we have to have, but they will give us a bare minimum.
I guess what brings my question to the forefront is we have a list of 10 essential services that are guided or directed by general statute. But mandated services are also guided and directed by general statute. So do we get to pick from the 10, or how does that?
So the essential services, again, from my understanding of doing this, leans heavier into accreditation. Essential services really, especially now, our accreditation just changed. We went from 157 standards now to 47, and all of those start to align with that essential services, and understanding that there are certain things that are mandated, which we have to have, and some counties do only run by the bare minimum. So doing essential services is a lot harder. So the state is trying to figure out how they cannot burden the county as much. And so I think they're making progress, but I'm sure in some counties that's extremely challenging. So if we, for example, I believe one of the essential services is research. Is that one of the essential services? Okay, so research. For example, I don't have the capacity to do research in-house. That's not something we have here. But what I can do is work with a university who has that capacity to do that deep, or work with the school systems to do that work. So we're still executing those essential services, but I'm not going to get punished for not being able to do research. Same thing with linking people to care. There's a lot of services that we don't need to do. We don't do dentists. We don't do dentistry. But if someone came into our primary care clinic and said, I've got an abscessed tooth, we link them to care. So it's just giving us almost a framework of what best practices to do, so that we're not just doing the bare minimum. It's an encouragement.
Actually, how does,
Did you say, how does AI? That's a great question. Certainly. Yep. But I think that goes into the bigger question of what is best practice within the use of AI, especially when it comes from a public-facing entity, and where does that limit kind of show up. But I do think there's a lot of opportunity, and I know that Mr. Epley's really looking into that to find out what works best for this community and for the county. Mr. Epley, if you have anything to add, I'm happy to.
No, I just think that I was taking a couple notes here, and you're right. I would say that the required services, and you're going to talk about consolidated agreement in just a moment, but there are some things that I'll say can't be subcontracted out. And one of the biggest responsibilities and why you have to have a health director is under this assurance lens is providers that have sliding scale fee schedules that accept Medicaid. Because there are many communities that do have pediatric care, but they don't accept public insurance, for example. And then in that case, the health director can assure that low-income individuals receive those benefits, and the health department may have to offer it. In Burke County, especially for rural Western North Carolina County, we really are very blessed with a fair amount of resources in the community that exist. Things like an FQHC that does have a dental program. A lot of substance use resources, and those folks check a lot of the boxes. So you'll see more robust size and programs offered at other county health departments that Burke County really isn't required to do. But a couple of those, like communicable disease, STD and TB, environmental health, you can't contract with an outside provider to do those. But to me, the essentials are what you have to fundamentally make sure that everybody in your community has access to. And I think about it as a do-it-yourself versus subcontract out model.
Yep. Thank you for that. All right, the state law. So mandated services. State regulations require that every local health department either provide or ensure the provisions of 12 mandated services. And that is the general statute that will outline which services those are. So mandated services, we must provide individual on-site water supply. We must provide sanitary sewage collection, treatment, and disposal. We must provide food, lodging, and institutional sanitation. We must provide communicable disease control, and we must provide vital records registration. Now, here's where I was saying, here's where we can't ensure based on what we're capable of doing, what's needed, and what exists in Burke County. We need to provide or ensure child health, maternal health, family planning, dental public health, home health, adult health, and public health lab services. So here's our general statutes for accreditation. And accreditation is what holds us accountable. That is where the state comes in and they do review our documentation, they review what we said we have done, and then they compare it to what's required by the law. So meeting accreditation standards, provide evidence of completion of the prescribed activities. We must be accredited by the North Carolina Local Health Department Accreditation Board, and accreditation by another accrediting body does not satisfy state law requirement. So what that is meaning is that we have 2 accreditations. I know you guys have heard this. We have the North Carolina accreditation. That's what's mandated. Then we also have a national accreditation that is not mandated, which means if we only had that national and we did not have the North Carolina one, we would not be a health department. So we went just above and did an extra accreditation because it helps with quality improvement work internally. So obtaining and maintaining accreditation is a condition of receiving state and federal funds. Oh, that was the only one on that one, sorry. And here's our consolidated agreement. This is the agreement between the health department and the county and the state. All health departments enter into contracts with the state in order to receive state and federal funds. They impose some programmatic and administrative requirements, and they include some service mandates. So examples of obligations under federal law, which these are yet another layer of requirements that we must meet, is the Affordable Care Act's anti-discrimination rule, our HIPAA compliance with privacy and security rules, our Civil Rights Act Title VI requirement for provision of language assistance services at no cost, Personal Responsibility and Work Opportunity Reconciliation Act, requirements regarding which services must be provided to clients regardless of immigration status. This has not been updated, so there are possible changes that may be coming down the pipeline. And strings attached to particular programs. This is just an example of some of the local health directors across North Carolina. So appointment of the local health director. In a county or district, you are appointed by the Board of Health. You must have a minimum education and experience, and then the responsibilities of the health director are found under 130A41. Public Health Authority the health director will be appointed by the Public Health Authority Board, minimum education and experience within this rule. And then Consolidated Human Service Agency, the director is appointed by the county manager. If does not meet the health director qualifications, the Consolidated Human Services Director or county manager must appoint someone who does. It acquires powers and duties of a local health director, but may delegate. And those are the general statutes that fall under that one. So the health director does wear many hats. I have found that out quite intimately lately. They are an administrator, an enforcer, an educator, and a community liaison. So examples of administrator, the Consolidated Human Service Director appoints the Consolidated Human Service staff with the county manager approval. Whoa. Again, I'm sorry, I did not make these slides. You may not be constructed to abrogate the authority of the county commissioners and a public health authority board contracting authority. Are you reading anything into this for this slide? Okay.
No,
it seems a little all over the place. Yeah. All right. Examples of enforcing. So school immunization requirements, in case we need to quarantine and isolate for communicable disease mitigation. We investigate communicable diseases, abate nuances and hazards, and impose some penalties if our Board of Health is supportive of this, and Board of County Commissioners as well. Go right ahead.
I'm sorry if this becomes an irrelevant question later in the slides, but are these examples mandated?
Authorities?
Yeah.
Yes, the immunizations is something that the health director does have authority of, but there's strategies in how you go about
I
this.
guess my question is it a product of state law? Are all of these things a product of some general statute?
This particular one is, yes.
Okay.
Like the immunization, quarantine, you will find in general statutes. Investigating communicable diseases falls within that quarantine general statute. The abatement, and then penalties, there's some language, but it's not robust. Yeah, go ahead.
The penalties imposed are defined by state law or us?
There are, yes, and it's both. So there are state laws, and then there are local laws if you wanted to tack on. Those can be penalties as well.
Okay, thank you.
So we are educators and liaisons within communicating health issues, which is why we have our health education group. We promote health benefits, advise locals, we coordinate and collaborate. So that is more of our community health, our community strategic lens. That's what the health director is supposed to go and meet the community, know the stakeholders, and know who is what part of what system and what sector, and how do we work together. So it looks like we might be transitioning to different styles of local governing boards. A local board of health shall have the responsibility to protect and promote the public health. This looks like an older slide, but these are indicators of which counties have changed to different governing board styles. We can always share that if you guys would like the footnotes in case I did miss anything, but thanks. Different local boards of health must be residents of Burke County. They are appointed or removed by commissioners. The composition is dictated by statute, and the health director serves as the secretary. So the role of the boards of health is rulemaking. A board of health shall have the responsibility to protect and promote the public health. The board shall have the authority to adopt rules necessary for that purpose. This is where it says if you need to take an extra layer, you can take an extra layer if approved by the Board of Health and Board of County Commissioners. What is true? What is a Board of Health rule? Prohibits citizens from doing something, requires citizens to do something, enforceable in court. It is enforceable in court, and a person could be charged with a criminal misdemeanor, subject to an injunction ordered by a judge and fined by the health director. For example, one of the general statutes that we do have that lies within communicable disease is related to STDs. There are very specific STDs treatment and testing requirements that have to happen, and if a person does not follow what we have set in place, it could result in a misdemeanor. So that is an example of a general statute rule that we have in place.
When does our responsibility for, lack of a better way, is contact tracing? I know some of those are permanent, some of them are treatable.
I'm sorry, say that.
Some of those conditions are considered permanent and some are treatable.
Right.
When is our responsibility for contact tracing begin and end in those circumstances?
It really does vary depending on which disease we're investigating. There's some, for example, perinatal Hep B that's a contact tracing that lasts over a year. Could be a little bit further if they're not necessarily following the rules. There's some that we give them a very small turnaround time, and we try not to go into enforcement as quickly as possible. We try to meet someone at the pace that they're at that also means that they're not going to spread it as much. So we try to find that balance in between. But if we're having to extend our resources to do that, that's when we get into the question of should we enforce a little bit more or not.
And those enforcements are state enforcements, local, or both?
Typically, right now, all we have is state enforcements. So we do not have any local enforcements right now. Another example is some jurisdictions have local rules governing private drinking water wells, on-site wastewater, mosquito controls, and wearing masks in public spaces during communicable disease emergencies. So interactions with other state rules, Board of Health rule may be more stringent than Environmental Management Commission or Commissions for Public Health rule, where a more stringent rule is required to protect the public health. So that is explaining we are allowed to do more, we cannot do less. General limitations, they must be related to health, must be reasonable, and must not discriminate. Additional limitations for local Board of Health rules, food and lodging. The local rules are generally not allowed. Private drinking water wells, local rules must adopt and supplement the state rules. On-site wastewater, local rules must adopt and supplement the state rules, and the state must approve the rules. And then anything related to smoking, local rules may regulate smoking in specified places. The Board of County Commissioners must approve the local rules. So you can see there's still some limitations, but you can see that the state is trying not to impede on what happens locally. Adjudication. So when does a local Board of Health act like a court? Under my time here, we have not needed this to happen. But when a person is aggrieved by the interpretation or enforcement of a local Board of Health rule or imposition of fines or appeals is when you guys will step into this space. The board may be asked to hold a hearing about the enforcement of a local Board of Health rule or imposition of fines. So you'll act as a quasi-judicial body or court. You'll evaluate if legal authority exists for the decision. Evaluate if the decision is supported by the evidence. When you hold a hearing, the board must consult with its legal counsel regarding due processes and procedures, follow strict timelines, keep a verbatim transcript, issue a written decision, and follow the procedures described in state statutes. And then the board's decision may be appealed to the district court. Have not had to experience this.
So do all of those provisions apply inside the county and municipalities, or is there a separation there?
I would have to clarify that.
Good question, Randy.
Honestly, if that is a conversation to have, I'd have to clarify.
You know, I remember as we all worked through the last 5 or 6 years, lots of these things have came up. And I don't recall any local rule being passed in North Carolina in like the last 50 or 60 years. Funny, the history on Board of Health started in the early 1900s, before 1910. EPA and DEQ were both created in the 1970s. So the likelihood of local legislation for public health being more strict than both state and federal is pretty slim. I do know that there were some local rules passed, maybe very temporarily, about curfew and those type of things.
Mm-hmm.
But the idea that something's going to become a quasi-judicial function at a local level is pretty slim. I do think, though, Commissioner, if a county Board of Health passes a rule or an ordinance, unless the municipal function has something that also governs that, then it would be countywide. That's my understanding.
Last thing, administration. So Board of Health identifies the director and identifies the candidate. They must be also vetted and approved by the state health director, who evaluates the education requirements, and then also vetted and approved by the county commissioners through the county budget, and you guys also have oversight of the director's salary. And then we have the annual regular evaluation of the health director. So Consolidated Human Services, I won't spend too much time on this, hired and fired by the county manager with advice and consent of Consolidated Human Service Board. County manager responsible for evaluating performance. If the director doesn't satisfy education and experience requirements, the consolidated director must appoint a person who is. And the Board of County Commissioners for the Consolidated Human Service decides whether employees of a consolidated agency will be subject to the Human Resources Act or subject solely to county personnel policies. A local board of health may impose a fee for service to be rendered by a local health department, except where the imposition of a fee is prohibited by statute or where an employee of the local health department is performing the services as an agent of the state. For example, environmental health, there are some aspects where they're an agent of the state and are executing those duties on behalf of the state. Board of Health will review and approve the local health director's department's budget. Consolidated Human Services Board does not transmit or present the budget to the Board of County Commissioners. Board of County Commissioners. So the County Health Department and Consolidated Human Services must approve the departmental budget, which is what we do annually. And then in the other models, the District Health Department and Public Health Authorities, they are not required to get approval and must approve requests from appropriation from the county budget. So legal responsibilities and authority of public health in North Carolina and the sources of public health laws, roles and responsibilities of the local health departments, health directors, and the Board of Health. Now here are all the different governing structures, member roles, and the effective governance. Does anyone need to pause before I get started? Okay. So, Board of County Commissioners may assume powers and duties of the Board of Health. They can create a consolidated human service agency and appoint an additional consolidated human services board. Do both by creating a consolidated human service agency and assume the powers and duties of the consolidated human services board. Those are our three options. So assuming powers and duties of the board. So a Board of Commissioners may assume the powers and duties of a county board of health or a county consolidated human services, or they can assume the powers and duties of other county boards. And those are the steps in order to do so. Authority of Board of County Commissioners extends to the County Board of Health, County Board of Social Services, Consolidated Human Services Board, and other board or commissions appointed by the Board of Commissioners that acts pursuant to the Board of County Commissioners authority. So what is not included is, that is a mental health, substance abuse services board. Cannot remember the term off the top of my head. Public health authority providing public health services, public hospitals, and multi-county boards. So the Board of County Commissioners as the Board of Health. Your role is to protect and promote the public health. Your powers and duties include appointing the local health director, making policy for local public health agencies, adopting local public health rules, adjudicate disputes regarding local rules or locally imposed public health administrative penalties and fines, impose local public health fees, and satisfy state accreditation requirements for the Board of Health. So these are your powers and duties. The Advisory Committee on Health When a Board of County Commissioners assumes the powers and duties of a Board of Health or a Consolidated Human Services Board that includes public health, the Board of Commissioners must appoint an advisory committee of health. The advisory committee membership must include commissioner, physician, dentist, optometrist, veterinarian, registered nurse, pharmacist, professional engineer, and 3 members of the general public, which we do currently have, minus the veterinarian role, which we are working on. Division of the Board of Health powers and duties versus the advisory board. The Board of Commissioners acquires all the legal powers and duties automatically by law. You adopt local public health rules, you'll adjudicate, and you acquire it acquires additional statutory duties. The advisory committee can advise on public health matters. They can also carry out activities that may be delegated to the advisory committee. There are a difference between some items are non-delegating and some you can delegate, which we went through before. So examples, Board of Commissioners cannot delegate being trained. You must go through this. You must assure development, implementation, and evaluation of local services and programs. You must establish public health goals and objectives. And then you must assure resources to implement the essential public health services, essentially the way you are functioning right now. What you can delegate is a review, assessment data, and citizen input. You can delegate planning and monitoring of progress towards the health goals you set in place. You can support public health funding and programs and community health improvements. The advisory committee can advocate on behalf of public health, and they can promote community-based partnerships. So they are essentially your tentacles, your eyes and ears. They are your community members that you have that will convene and give feedback from the community. A Board of County Commissioners that has assumed the Board of Health powers and duties retains the legal authority to adopt the public health rules. The authority may not be delegated. And the Board of Commissioners may ask the advisory committee to advise on the rules and assist in developing and promoting the rules. But ultimately, you will approve and adopt them. So the health director, same minimum education requirements and qualification requirements, and must have a background in medicine, public health, and public administration. Here's the Consolidated Human Service Agencies. That is the areas at which we function in. It looks like a Consolidated Human Service Agency can have either a separate board or an advisory committee. Consolidated Human Services Board acquires most powers and duties of health. Powers and duties related to fees, compliance, budget, oversight, and public relations and advocacy. They lack the authority to appoint the agency director. And they prohibit from transmitting and presenting the budget. And a Consolidated Human Service Agency director or appointee presents the budget. There's just more of the Consolidated Human Services Board. They will make policy for local public health agency, ensure compliance of mandates, adopt local public health rules, adjudicate, impose local public health fees, and satisfy state accreditation. Very similar to ours. This is social services. I'm not going to go over social services. Who is on the Consolidated Human Services Board? This is different from ours. I don't want to spend time on that for you guys. So compare and contrast. This is the difference between the two models. A Consolidated Human Service Board has up to 25 members. They're all appointed by the Board of County Commissioners. The composition requirements for some of the positions, and they have 2 consecutive 4-year terms. Our county, as the Board of Health, will have 11 members. They're all appointed by the Board of County Commissioners. Composition is still also required for most positions, and we serve on 3-year terms. So the Board of County Commissioners as the Consolidated Human Service Board. Some roles and responsibilities of Board of County Commissioners acting as a consolidated health service as appointed by the board. They are also required to have an advisory committee. Same membership as the county board, and additional members to represent social services and other agencies or departments is included in this model. Again, this is the requirements for the director. This is different from ours. No minimum education and requirements. Must be able to run a local agency that carries out numerous state and federal programs. Must have background in county administration, social services of public health. They're appointed and supervised by the county manager. Must appoint a person who qualifies as required by the law for the local health director. Here are more specifics for this model. Automatically requires the legal powers and duties of the local health director. May delegate health director powers and duties to appointee. Documents this director's delegation of local authority. And in public health emergency, important actions may be delegated if it is unclear who is exercising the authority and authority has not been delegated. Board member guidelines, roles, and responsibilities. So, guidelines is to educate yourself about your community and the public health status, which I'm here to help you guys learn more of that. History, goals, and achievements and current situation of the Board of Health and the Health Department. So learning our past, learning what it was like for the Health Department and the Board of Commissioners in the county in previous years so that we can look at what we can do in the future. Attending meetings, reviewing all meetings material, carrying out assigned work between the meetings, and participate in open and constructive dialogue. So as the Board of Health, you'll be representing public health. So represent public health to the community and speak for the board when delegated. We'll work to link the community to the health department, and we'll act as an advocate for public health by maintaining an active involvement. The chair role and responsibilities. The chair is the leader of the board. They'll run the board meetings, speak for and represent the board, promotes the teamwork, addresses any performance issues, and recommends removal of 2 county commissioners. The chair will also initiate strategic planning, initiate the annual evaluation of the health director, work with the health director to set the meeting agenda, and counsels and consults with the health director. That is the role of the chair, which the advisory committee, we also exercise these roles as well with the chair of the advisory committee. Board member removal. So the commission of a felony or other crime involving moral turpitude, violation of a state law governing conflict of interest, violation of a written policy adopted by the County Board of Commissioners, habitual failure to attend meetings, conduct that tends to bring the office into dispute, failure to maintain the required qualifications for an appointment. So those are grounds for removal of a board member. And this will also translate into the advisory board as well. So guidelines for the meetings and activities. We must have a quorum. All matters discussed must be recorded in the minutes. Approvals must be recorded in the minutes, and the minutes should be preserved, which we do have an internal process for that. Guidelines for board meetings continued. So NC open meetings law is which we need to follow. So notice of all meetings must be given to the public. We must maintain manual and operating procedures and divide committees or subcommittees when appropriate, including members from outside the board. So we do welcome, if there are subject matter expertise, to come into some of these subcommittee meetings and help us work through some of the questions we may have. The overall role of the board, again, in case you missed it the first couple of times, is rulemaking, adjudication, and policymaking. We're going to leave day-to-day operations of the health department to the health director and develop and support policies designed to promote and protect the public's health. The number one goal is to support the health department in achieving its goals. which we will do together through continual communication. So in summary, board members should educate themselves, be involved in our board meetings, seek to link community to health department, represent the public health, speak for the board when delegated. Meetings must follow the specific guidelines. The chair does have a specific role. Board's overall roles in rulemaking, adjudication, and policymaking, and the board's #1 goal is to support the local health department in achieving its public health goals. Oh my God. Are we doing okay before I get to the next one? Okay. Governing challenges. So a lot of the challenges that happen within the relationship between the governing board and the health director lie within vague task definitions. There's no hierarchy. There's little feedback, which I have seen that before, not in different scenarios. And then we don't have open meetings, or we are unable to achieve the open meetings. So this is their example of a partnership compass. So of course, our North is our citizens and our community. They're a big driver of what we do, how we move, and why we move. But then we also need to work with the director and the department staff, our governing board, and then our state and federal regulations. So we move this needle as appropriate, but our North Star is really always our community. Yeah.
It brings up a question. We understand that in law enforcement, for example, county lines often get blurred and they have to work with other agencies.
Mm-hmm.
How do we do that as public health? Because I can imagine they get blurred in the same way.
I think we try not to put too much limitations on the opportunity to help those who may influence the health of this community. So if, unfortunately, communicable diseases pass through county lines, and if there's an opportunity to help Caldwell County, who's having a massive outbreak, but we know that's crossing into our space, that's where we have these conversations with the board and with our community and with the commissioners to say, we owe it to our community to protect our citizens, which means we might have to roll our sleeves up and help our neighbors, you know? So I think that's where it's a larger conversation rather than a 2 feet in or dive in without looking at other consequences or
So are there
considerations.
currently policies and guidelines on that govern those interactions?
Mm-mm. So clearly defined roles and relationships is what helps create good governing bodies. We operate in a culture of values and ethics. We do work as a team. We think and act strategically together. We focus on policy priorities. We master small group discussion. We develop and follow protocols for board behavior and board staff relations, and we allocate time and energy appropriately to maintain an effective local health department. We need to set clear rules and procedures for our meetings. We need to understand the intergovernmental system and build productive partnerships. We need to provide oversight, establish and follow protocols, seek out and respond to our feedback, and model personal learning and development as leaders. So this is what it looks like to govern as a team. We're going to commit to the work together. No longer siloed, no longer one person's decision, but it's a group decision and a group effort. Open communication with each other, respect for each other, a sense of shared work. We want to be motivated to get this work done, willing to listen and understand different points of view, and if we disagree, we want to do it without causing disruption. So of course there are different levels of accountability. You have accountability to yourself. We have accountability as a board. I have accountability as a health director, and our staff has accountability. The citizens have their own accountability in the region, state, and nation. So 6 expectations for effective board of health and director relationships. The board as a body sets the direction. The board respects the role of the health director as chief administrator for the health department and allows them to demonstrate competency in their role. And the board and the health director jointly strive for good service for their community. The board is responsible for board members' behaviors. The board freely gives and seeks out feedback. The board works with the health director to be a high-performing governing body. And this is just an example of, best practice in the sweet spot. That one. So in summary, effective governing is an honor to serve on a governing board for public health. Serving as a governing board for public health is a weighty responsibility. Strive for partnership between the board and the director, and providing good service to your community is the ultimate goal. And we made it. Thank you.
All right, thank you, Dr. Jarrett. Any questions, any comments before we entertain a motion? All right, gentlemen, you have in front of you the handbook that's referred to, and I'll entertain a motion to acknowledge receipt of the training and the written handbook in accordance with North Carolina Administrative Code 10A, NCAC 48C, and 48D.
So moved, Mr. Chairman.
Thank you, Mr. Burns. All those in favor signify by the uplifted hand. 4-0. Thank you very much. Now, this brings us to updates from our health department, and this will come from Dr. Jarrett as well.
Might be a lot of me today. So in your packet, you'll find our annual report. This is something that I do like carrying forward from previous administration. There are two options for you. There's an executive summary, and there is a more in-depth explanation of what we've done over the last year. So I'm pleased to present the Burke County's Public Health's 25-26 fiscal year annual report and executive summary. The executive summary offers a concise snapshot of the department's service data, key accomplishments, community impact, and financial stewardship. The full annual report, included in your packet, provides a more comprehensive review of our programs, performance, and the progress during the last fiscal year. I'm also pleased to share that over the last fiscal year, Burke County Public Health has provided 1,400 immunizations, 11,000 laboratory tests. We've helped 2,300 WIC-eligible participants, and we've completed 659 food and lodging inspections, making it the first year in over a decade we've reached 100% in inspection requirements. Although we've had a significant year of turnover related to retirements, I'm truly excited for the future of this department and the team we continue to build. This department enters fiscal year 26-27 committed to responsible fiscal stewardship, efficient operations, a measurable alignment with county priorities, including maintaining Burke County as an employer of choice.
All right, thank you, Ashley. Gentlemen, you've had this report, and we've heard the summary. Hope you've had a chance to look at it. It's good, good report, Ashley. All activities that the health department has been involved in. Appreciate all the work. Any questions, gentlemen, on this report? Seeing here none, I'll entertain a motion.
Mr. Chairman, I make a motion to accept the report as presented.
Thank you very much, Mr. Burns. All those in favor signify by the uplifted hand. 4-0. Madam Clerk. Thank you again, Ashley. Brings us to item 7, scheduled public hearings. We have none today. Brings us to item 8, the informal public comments. I'll open the floor at this time. Do we have any public comments today? I don't see any public comments today.
Sign up for that.
I'll close public hearing at this time, public comment period. We have no consent agenda to consider today. Then we have a couple of items for decision. This will bring us to the first one also from the Health Department, change the Board of Health Board meeting from annual to semi-annual. This will be presented by Dr. Jarrett.
Hello again. So I'm requesting that the Board of County Commissioners convene as the Board of Health twice annually, rather than once, so that we can strengthen oversight, communication, and alignment with our shared priorities. A second meeting would provide a timely opportunity to review departmental performance, emerging public health needs, financial considerations, and any policy or programmatic changes that are required board awareness for action.
Hey, gentlemen, you've heard this request. Any comments or discussion on this matter?
I would just say that something Ashley and I've talked about is that would be a really much more of an operationally focused meeting on performance and really delve into things that this board may want updates on or want them to, want the department to focus on in a more strategic way. We haven't done that last year or this year to get the required training and those type of things. So, you know, it seems like an appropriate use of time, takes a little pressure off of this July meeting as well.
Right. Gentlemen, any suggestions? Is that something that you want to try to do on the same day as our pre-agenda, or do you want to have it a completely separate meeting? Is there I mean, it will be a completely separate meeting that regardless, but do you wish to try to schedule those on our perhaps pre-agenda day before or after, or do you want to do a separate day for this?
Well, I think it personally that maybe some of our pre-agenda meetings get pretty lengthy.
Mhm.
I mean, if everybody wants to stay here till 10 or 11, we can do it. But it sounds like these Board of Health meetings will be very important, and we're going to dive into some information that may take time. So I feel like maybe we do need to have it on a separate date.
I would concur with Commissioner Berry. I would also like to see this second meeting include some strategic talking points that commonly ask questions of us, like where are we at on septic tank permits? So if we could, between now and then, develop a list of, say, 10 community talking points that we could make sure that we touch on to make sure the public's aware.
Okay. All right, well, we'll ask the manager and Ashley to think about some dates and times for that, and we'll include those in our typical annual calendar. Okay. I'll entertain a motion to approve the Board of Health meeting schedule to be semi-annual with dates to be set by the board's annual schedule.
So moved, Mr. Chairman.
Thank you, Mr. Barry. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. Our second item, also approval of Health Department policies presented by Ashley.
Thank you again. Before you have policies relatively close to 100 that will be that have been reviewed and needing approval by the Board of Health. We've revised 67. We have 12 new policies, and 32 policies were reviewed with no changes or recommendations. Many of the revisions are administrative in nature, such as updating the department's name from Burke County Health Department to Burke County Public Health, correcting some terminology that exists, updating staff assignments or some links, and updating any regulatory changes from the state or federal requirements.
Okay, gentlemen, I hope you've had a chance to look at these. Any questions on any of these for Ashley? All right, seeing here none, I'll entertain a motion.
Mr. Chairman, I'll make a motion to approve the Board of Health policies as presented.
Thank you, Mr. Stroud. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. All right. We have no reports and comments at this time. Madam Clerk, we'll move to vacancy announcements.
Sure. So as you guys are aware, the Burke County Public Health Advisory Committee
serves as an advisory capacity to the Burke County Public Health Department and the Burke County Board of Health. This committee provides community input, promotes public health initiatives, and supports efforts to improve the health and well-being of Burke County residents. Committee members represent a broad cross-section of the community and help identify emerging public health needs, priorities, and opportunities for collaboration. As Dr. Jarrett has already mentioned, we do have a full board with the exception of a veterinarian. And so we are working with the Animal Services Department to see if we can get that seat filled.
Mr. Chairman, I have a question about that. So many of the boards for which we make appointments, we can make appointments from contiguous counties. Is there a state law that says we can't reach outside of our county to one of our contiguous counties to say, try to fill this position?
If we don't have something within our grasp, that's completely allowable. I mean, if it doesn't exist in Burke County, we're allowed to seek elsewhere.
But even though, I mean, I would assume you guys have probably already approached and exhausted the few veterinarians that we have that live in the county. And they have obviously probably declined. Does that trigger and give us an opportunity to reach just outside of our county to?
Absolutely, yeah.
Okay. And we're doing that?
I'm sorry.
And we're doing that?
We're gonna try one more effort with our newly hired veterinarian with Animal Services, and then I think that will be the next move.
Okay, thank you.
Other questions? All right. With that, I believe that brings us to item number 14, adjournment.
Mr. Chairman, I would be proud as punch to make the motion to adjourn this meeting.
Thank you, Commissioner Burns. All those in favor signify by the uplifted hand. And that is all of us. Thank you very much. Thank you for being here today. Thank you for taking care of this important matter. Thank you, Ashley, and your folks for being here.
That was a great training. Thank you.
Thank you.